Technical difficulty with the recording, Chris. All right, there he is down on the ground. He made a full recovery. Went to the hospital. He's back running. So, anyways, heat illness, pretty serious issue, very common. According to the CDC, heat illness during practice or competition, the leading cause of death among U.S. high school athletes, uh, considered preventable death. A lot of states have uh, heat programs to, things to what we'll cover as far as prevention and trying to intervene. Chicago Marathon has had a couple of years where it's been very hot. This was in 2015. The race was shut down, I think, over 3 hours into it, after one person died, and I think 40 or 50 people were hospitalized with heat-related illness that year. And thousands didn't finish because they finished the race or shut the race. So the National Center for Catastrophic Sport Injury Research mostly looks at head and spine trauma in football athletes, but they also track just overall high school athletic deaths. And so there are on average 3 football players a year in the U.S. that die from heat stroke. That number's lower in recent years, not because temperatures are better, but because I think we're doing a better job with prevention and recognition. If anything, temperatures will continue to get higher. This will become bigger. And so state by state, this varies. The Southeast is kind of the worst area for this as far as high temperatures and very popular football. But depending on where you are, it can depend on what your resources are that are available at your local high school. And it is mostly high school football players we worry about in the fall, especially in August, those preseason weeks when athletes are not acclimated to exercising in the heat. They get out there, it's hot, they're not used to it, they're doing 2-a-day practices, and they can get into trouble with these things. So highest incidence in August, most playing football, 70%, 83% during practice. Unlike a lot of our injuries, this is a practice-related injury more than competition. And it can happen in the middle of practice or even after extended practice. And we'll go through risk factors, but being overweight or obese is a risk factor as well. This was a more recent study from 2021 looking at exertional heat stroke at the Boston Marathon. And it was interesting. The younger and faster runners had higher rates for exertional heat stroke, which you might think the opposite. Maybe you're deconditioned, overweight, middle-aged athlete. Not pointing fingers, but that might be me. But it's actually the younger, faster runners, guys that are working really hard and pushing this, like that elite runner we looked at the video of. This was a picture from the Beach to Beacon a few years ago. This was a runner suffering from exertional heat exhaustion or potentially stroke who had to be helped across the finish line by a competitor. This guy did the right thing, helped his competitor and didn't leave him in the dirt. And this is from Runner's World, I think, quoting that last article about the Boston Marathon. So risk factors, who are we worried about, and when are we worried? So environmental conditions, obviously, the temperature itself, the relative humidity, the more moisture in the air, the less you're going to be able to kind of get rid of that heat from your body. Airspeed, it can be helpful or a detriment if there's none. Radiant heat from the sun. And this WBGT is the wet bulb globe temperature. We'll look at that in just a moment. And any barriers to evaporative heat loss. So if you have helmets on, excessive clothing, athletic equipment, wetsuits, things that'll slow you down. If they're not heat acclimatized, if they're in poor physical condition. They listed overzealousness. So if you're exercising really intensely, again, those might be your kind of young and overexerting themselves while they're competing. Increased BMI, dehydration, illness, a history of heat illness, certain medications, and then electrolyte imbalances. This is the same type of information looking at your system as like an engine. And this is a little bit helpful maybe to think of like where that comes from. Yeah, I've got a few for Liz in here. There were some good, I couldn't pass them up. So just looking at, where might you get either too much heat buildup or not enough heat dissipation, looking at your body like a So how do we measure heat? Is it, they talk about the heat index, which is a mixture of temperature and humidity. That's a measurement that's done in the shade. That doesn't quite get at the true temperature or the true heat that an athlete can feel. So we use this wet bulb globe temperature, which is just a fancy way to measure several different factors that affect heat: temperature, humidity, as well as wind speed, ambient heat from the sun, and solar radiation. It's used by the military and OSHA as far as their guidelines, and that's what we use to kind of help determine when you should not compete or when you should modify your activities. Um, it's just another kind of algorithm looking at different types of heat loss and wet bulb globe temps and when to stop activities. So looking at different types of heat associated illness. So this was 2014 Miami Heat versus the San Antonio Spurs NBA Finals. You guys remember this? LeBron James had serious cramping issues, and they thought the Spurs were intentionally jacking the Heat up in their arena, which turns out was a great strategy because the Spurs won that series. But LeBron James had to leave Game 2 with cramps and only had 48 hours to kind of recover and turn around. So serious issue because LeBron had kind of a known issue with muscle cramps. Um, so could be a competitive advantage. So exercise associated muscle cramps. This is kind of the most benign of the exertional heat illness family. And this is just involuntary, painful contractions of skeletal muscle during or after exercise. The term heat cramps is misleading. It doesn't necessarily come from heat itself, although typically heat is involved. We don't know exactly all of the factors that cause this. It could be from dehydration, electrolyte imbalances, altered neuromuscular control, or just muscle fatigue. So the treatment is varied because we don't really know exactly what to blame it on. People will kind of say, "Oh, your potassium's low. You got to eat more bananas, or you got to drink pickle juice, or eat mustard on the sideline, or all these weird things that our high school athletes do." This last year we had smelling salts on our sideline, and it's like, what the heck are you doing with those? I'd find them on the grass, on the dirt, broken smelling salts. I was like, what the heck? Yeah, right. Did you faint on the sideline? Um, but the treatment is specific to the person. You kind of try to find out what happened before. Was it overtraining, poor stretching, dehydration? Was it heat? What are the factors that you can modify those? And they do try to work with sodium intake and hydration. You're looking for less than 2% reduction in your body weight during exercise. More than that suggests you're losing an excessive amount of fluid. Um, so heat syncope, moving up the ladder from heat cramps to heat syncope. And this is really just like orthostatic dizziness. This is what you see like you're watching a wedding and all of a sudden the groomsman faints and falls down. That's the guy standing in the heat that's not acclimated, that has just orthostatic changes and faints. So this is not really an overexertion thing necessarily. This is just in that same family. But this can be for people that are not properly acclimatized to heat. They may be more prone to this, related to venous pooling, dehydration, reduced cardiac filling, and then low blood pressure, and down they go. So for this one, you want to lay them down, move them to a shaded area, elevate the legs, and when they recover, they can kind of be reassessed. Heat exhaustion. So this is essentially getting so hot to the point that you can't continue to participate. And you're acting normally, thinking normally, you just can't go on. And the theory is that this is from cardiovascular insufficiency or hypotension, energy depletion, or central fatigue. They probably will be warm, but not hotter than 105 Fahrenheit. So not going to be like in your heat stroke zone, but still going to be hot. And they're going to be heavily sweating. They may be dehydrated. They may feel sick to their stomach, tired, sweaty, have a headache, all those kind of like warning signs of overheating. Again, hot environment, poorly acclimatized, high BMI. And again, they should be acting and feeling pretty normally otherwise. So you're going to get rid of excess clothing, move them to a cool shaded area, do ice towels, fans, lay them down, put their legs up until they recover. If they don't recover within 30 minutes, you're reassessing and you're moving them to a higher level of care, depending if you're worried. And to know if their temp is 105 or less, you've got to get a temp. If you're worried about that, that's kind of a judgment call at that point. If they're walking, talking, just not able to go on, you probably don't have to stick a thermometer up their butt. But if you're worried, that's what you're. Exertional heat injury. So this is kind of just below heat stroke. So we're moving up that severity scale. And this is a moderate to severe heat illness that does result in end organ or tissue damage. So this can cause rhabdo, liver or kidney impairment, or even gut damage from heat issues. And this is due to sustained high body temperatures. And the body temp is in that range of 105 Fahrenheit or 40.5 Celsius or higher. So you've got to check a rectal temp. So they may complain of muscle pain. They may be acting a little more strangely. This one you're going to be watching very closely and then be cooling, and we'll talk about cooling protocols. Um, so heat exhaustion versus heat stroke, because these are the people we're trying to catch, are the ones that have heat stroke. And so they're ones that maybe are having a difficult time with their body cooling. They go from sweaty to lack of sweat, clammy. They can have hot, dry skin. They're going to be having the same like nausea, vomiting, headaches, and then they're going to be having CNS changes when they get to heat stroke. That's the big change as the brain starts to be affected. They're going to be confused, non-responsive, maybe belligerent, maybe even a little irritable, aggressive, just acting strangely. You're going to say, your brain is cooking. Something's going on. And yes, yeah, yeah. So and that's what we'll talk about a bit for heat stroke, because I think that's the big take home from this talk is if their temps 105, if they're having heat stroke symptoms, the best treatment time is of the essence. Those first 30 minutes matter. The longer that brain is hot, the more the risk of death goes up. So you've got to cool them before you ship them, even if EMS says we want them. All right, exertional heat stroke, medical emergency, and this is neuropsych impairment from elevated body temp. Um, Again, it can range how that appears, but it'll look altered. Um, and like that runner we saw, staggering, confusion, they may even be moving, and so they can be kind of confusing to know what that looks like until you see it. And this progresses to multi-system inflammatory response and multi-organ failure quickly, so you've got to respond. Rectal temp is the only accurate on-site measurement. You can't get a temp in the ear, a temp on the forehead. They're sweaty, they're hot, they're out in the heat. None of that's reliable. Um, and if the CNS, if they're acting strange, but their temp's 104 and change, uh, assume it's heat stroke and treat them accordingly. Sometimes these athletes are down and then brought to you, and so they may have had a period of cooling before they come. So maybe they were 106 and now they're 104 and a half. So don't be stuck on the 105. And if the rectal temp is unavailable, but you have a hot athlete that's acted funny, cool them off. So your goal is to get them to 102 within 30 minutes of collapse. 102 is that temperature where they're out of the danger zone, but you're not at risk of like overcooling them. All right, and cold water immersion is your best treatment. You can do ice towels and ice packs on the neck, armpits, and groin. It's not as effective, but use what you have. And you should monitor rectal temp every 5 to 10 minutes while immersed. Um, and I have a little algorithm through here later, but one of the things I was reading is that having someone agitate the water to circulate it is helpful to keep the cold water moving. So just getting them in, but there's things you can be doing actively. You can be cooling, moving the water, checking temps and vitals. All right, so if a physician is on site and you can cool immediately with complete resolution of symptoms within 60 minutes, they say you don't have to transfer, but I think for our purposes, if you're treating someone for heat stroke, we're sending them on. This is the first chart for Liz. So this just is the same thing, just kind of going through athlete collapses to assess, assuming they're not having cardiac arrest, right? And so they've got vitals, they're just, you suspect exertional heat stroke. You're going to get a brief history, take a rectal temp. The temp is high, you're taking off layers, you're putting them in the water, you're monitoring their temp until they get to 102. and then you either monitor for recovery or ship them. And so this is just the guidelines for how to dunk someone in water. You would think that would be pretty self-explanatory, but here's a 10-step approach that you can go through. But the basics are have the tank ready, have it filled with water. You can add the ice at the last minute if you need it. Have a cooler full of ice and a tank full of water. Um, get vitals before they go in. Assess their breathing and airway, make sure all that's okay. And then they may need help in the tub. They're going to be agitated and not, following your instructions. You want to get as much of their body in as you can, head and neck out, arms and legs in. Um, they may be, again, fighting or resisting this because it's going to be cold. Uh, and then you're checking a temp every 5 to 10 minutes. Vigorously circulate the water. You can have, fans, cool wash on the head, anything you can do to help cool them down. If you have an IV, this is a good time when they're in there. You can take a few minutes. You got 5 minutes for your next vital check. Talk to your team, have a few minutes talk, get an IV in if you have it. Be talking about when your next vitals are, when you're going to ship so that everybody knows the plan. This is your time to talk. And then when to transfer. All right, so return to activity. So when can each of these athletes go back? So if they've had muscle cramping or heat syncope are two kind of like most benign conditions, it's just essentially when their symptoms resolve. You can reassess them, make sure they seem safe to participate. If you're still worried, you're holding them out, but if they seem they're good to go, they can keep going. Heat exhaustion, they don't recommend same-day return to play. They're at higher risk for heat temperature going back up and having worsening symptoms. For heat stroke, a lot of people are cooled and are home the same day, but there's often a period of rest that they need to kind of recover. And the guidelines are they have to be asymptomatic with normal labs. So assuming they went to the ER and had maybe elevated creatinine or muscle protein. So this is an algorithm from Fran O'Connor from the military, because a lot of our data for returning from heat illness comes from the Army. So this talks about different levels of Army stuff. I just put this in for Liz too. This is way too busy. I like this chart better. This was just like keep them out at least a week, have a follow-up. They need to have a normal exam, normal labs again if anything was affected. And then you're going to start them in a cool environment, and you're going to go through a progression of activity like you would for any return to sport from injury. And you're going to watch them for heat tolerance, and you're going to build them up as far as intensity and heat until you get them going. And if they struggle with that, you can do an actual exercise heat tolerance test. But again, it could take up to a month. For some of these, issues can last 6 months to a year as far as sequelae. So prevention, pre-participation screening, you're looking for risk factors or previous heat illness. And then heat acclimatization. So that's this goes through kind of a progression for preseason sports. This is from the NCAA. So like you don't start them with the most intense exercise the first day of preseason. It talks about a progression over a week as far as like not starting with helmets even the first day. So you want to do, or not starting with full pads. So just kind of progressing as far as what they have for gear on. Climatization takes 7 to 14 days. And if you're not in the heat for a week, it goes away. And these are all the things that change physiologically when your body gets used to high temperatures. Just makes you a more efficient exerciser in heat. If you've had a recent illness, you should not play until you're well and then be monitored. Keep hydration available at all times. They should be always allowed to drink. Water is not a sign of weakness at football practice. Educate your staff, develop an EAP and practice it. Have a tub on hand if you think conditions are going to require it. Have a rectal temperature available and know how to use it. And then this is something I wouldn't have thought of either, is making sure that in between practice, either between double sessions or overnight, that they're in a cold environment, that heat exposure is cumulative. So if you're practicing in the heat and then you go home to a hot house and sleep in the heat all night, you're missing a chance to recover and get some of those physiologic changes to come back down. Right. These are resources I didn't list.